Welcome everyone, and thank you for joining us today. I'm excited to kick off this training session on ICD 10 PCS root operations. Today's focus is on Visu online coding training. Our goal is to help you step into your success by mastering these essential coding concepts. Over the course of this presentation, we'll explore the key root operations, learn how to apply them accurately, and enhance your coding skills. Let's get started and make this a productive and engaging session. ICD 10 PCS is the system we use for inpatient procedure coding in hospitals. Each of these codes is made up of 7 characters, and those characters are really key to understanding the procedure. The codes are divided into different sections, such as medical and surgical, obstetrics, imaging, and new technology. What's important to remember is that each character in the code provides specific information about the procedure itself. So, by looking at the entire 7-character code, you get a detailed picture of what was done, which helps with accurate billing and record keeping. This overview is fundamental to understanding how we classify and communicate about inpatient procedures effectively within the healthcare system. Let's take a closer look at the structure of the ICD 10 PCS code. As you can see, each code is made up of several characters, and each one has a specific meaning. First, the character for section tells us the general category of the procedure. Next, the body system character specifies which part of the body we're dealing with. Then, we have the root operation, which describes the main purpose of the procedure. The body part character indicates the specific part of the body involved. After that, the approach character explains how the procedure was performed. The device character shows if any device was used during the procedure. The qualifier provides additional details that might be relevant. Understanding this structure helps us interpret codes accurately and ensures precise documentation and communication in healthcare. This systematic approach is fundamental to how ICD 10 PCS organizes and classifies procedures, supporting clear and consistent coding across the industry. Today, I'll be discussing the concept of resection, which is essentially the process of cutting out or off a part of the body. This is a common procedure in various medical treatments, especially when removing diseased or damaged tissue. For example, in the case of a liver lesion, a partial removal of the liver tissue might be performed. In medical coding, this type of procedure is classified under a specific system. For instance, the PCS code represents an excision of the liver, performed through an open approach, without the use of any devices or special qualifiers. The root operation here is called excision, which precisely describes the act of cutting out tissue. Recognizing this concept is important because it helps us understand the intent behind the procedure and how it's documented for medical records and billing. So, in summary, when we talk about cutting out a part of the body, we're referring to excision, and understanding this helps us grasp the scope of surgical interventions and their coding within the healthcare system. In this slide, we're focusing on the concept of resection, which basically means cutting out or removing an entire body part. For example, if a surgeon needs to remove the appendix completely, that's considered a resection. The specific example here is the total removal of the appendix, which is coded as 0DTJ0ZZ in the PCS system. The root operation for this kind of procedure is called resection, emphasizing that we're taking out the whole organ or body part. Understanding this is crucial because it helps us classify and document surgical procedures accurately, especially when considering coding and billing. It also ties into the overall theme of understanding different types of surgical interventions and their specific purposes. Now let's look at the definition of drainage. Basically, it involves taking out or letting out fluids or gases from a body part. This is a common procedure in many medical situations where removing excess fluids can help with healing or relieve symptoms. For example, in the case of a lung abscess, drainage is often necessary to remove pus and other fluids that have accumulated inside the lung. When documenting or coding these procedures, you'll see specific codes used. For instance, the PCS code 0B9J3ZX refers to a drainage procedure. The approach in this case is percutaneous, meaning it's done through the skin using a needle or catheter rather than open surgery. And the root operation here is drainage, which clearly indicates the purpose of the procedure, removing unwanted fluids or gases. Understanding these key points helps us see how drainage procedures are categorized and documented, and how they fit into the broader context of patient care and treatment planning. Let's take a closer look at the definition of this key concept. When we talk about putting in a non-biological device, we're referring to a medical procedure where a device that isn't made from living tissue is implanted to monitor or help with a specific function in the body. An example of this would be the insertion of a cardiac pacemaker, which is a device that helps regulate the heart's rhythm. The relevant PCS code for this procedure is 0JH606Z, where 0JH indicates the insertion of a device, and the rest specifies the particular type of device and location. The root operation here is insertion, which is essential because it tells us that we are placing a device into the body rather than removing or replacing it. This concept is important because it helps us categorize and understand procedures involving devices that assist or monitor bodily functions without being biological in nature. So, whether it's for monitoring, support, or regulation, the key idea is that these are non-biological devices being implanted to improve or maintain health. Now, let's look at the definition of a replacement procedure. Essentially, it's when a device is placed into the body to take the place of a missing or damaged body part. This is a common approach in medical treatments, especially when a natural part can't be repaired or restored. For example, a total hip replacement involves removing the damaged hip joint and replacing it with a prosthetic device. In coding terms, we use the PCS code 0SR90JZ to specify this procedure. The root operation here is called replacement, which clearly indicates that a body part is being substituted with a device. Understanding this concept is crucial because it helps us accurately classify and code these procedures, which is vital for proper documentation and billing. This idea of replacement ties into the overall theme of our presentation, which is about understanding different types of surgical procedures and how they are identified in coding systems. Let's look at this clinical scenario. We have a patient admitted with acute appendicitis, which is a common but urgent condition requiring prompt treatment. The procedure performed is an open appendectomy, meaning the surgeon made an incision to remove the inflamed appendix. In terms of coding, the diagnosis is identified with the code K3580, which specifically indicates acute appendicitis without perforation or abscess. The procedure performed is coded as 0DTJ0ZZ, representing an open removal of the appendix. It's important to remember that when coding, we always list the principal diagnosis first, followed by the procedure code. This sequencing reflects the primary reason for the hospital stay and the main intervention performed. For example, in this case, the diagnosis code comes first, then the procedure code. This order helps ensure accurate documentation and billing. Understanding this sequence is crucial because it guides how we report these cases, ensuring clear communication and proper reimbursement. So always keep in mind, the principal diagnosis is listed first, followed by the procedure, especially when coding for hospital stays and surgical interventions. Now, let's take a look at ICD 10 PCS Section X, which is all about new technology procedures. These codes are really important because they help us identify new medical devices or treatments that are emerging in the field. They ensure that new innovations are accurately documented and billed. It's also worth noting that CMS updates these codes frequently to keep up with the rapid pace of medical advancements. Additionally, there are new technology add-on codes, which are used to specify procedures that involve new technology. This helps provide clarity and precision in coding, making sure we're capturing the most current and innovative procedures. Overall, understanding how these codes work is key to staying current with the evolving landscape of medical technology and ensuring proper reimbursement and documentation. Now, let's take a look at the procedure for introducing CAR T-cell therapy. This slide provides an example using the PCS code XW033C3. You'll notice that the code is broken down into different components, each representing specific details about the procedure. First, the X indicates that we are in the new technology section, highlighting that CAR-T therapy is a relatively recent advancement. Next, the W points to the anatomical region involved, which in this case is peripheral veins. The 0 signifies that this is an introductory procedure, often the initial step in the treatment process. The 3 after that indicates the approach through peripheral veins, emphasizing the method of delivery. Moving on, the C specifies that this is a CAR-T therapy procedure. The final 3 confirms that this falls within the new technology group, underscoring the innovative nature of this treatment method. Overall, this example helps us understand how the PCS coding system categorizes advanced, targeted therapies like CAR-T, making it easier to document and communicate these complex procedures within the healthcare system. It connects to our broader discussion about integrating cutting-edge treatments into clinical practice and the importance of precise coding for reimbursement and data collection. Let's wrap up by looking at the key points on this slide. First, ICD-10 PCS root operations are essential because they define the objective of each procedure. Understanding these definitions helps us code accurately and consistently. When we get the root operations right, it ensures that the procedure's purpose is clear and correctly documented. Next, proper sequencing and documentation are crucial. They not only reflect the true clinical picture, but also ensure that the healthcare facility receives appropriate reimbursement. If these steps are done correctly, it benefits everyone involved, patients, providers, and payers alike. Finally, with the rapid advancement of medical technology, new codes have been introduced specifically to track these innovative treatments. Staying updated on these codes is vital to ensure all new procedures are captured accurately in our coding systems. So, in summary, understanding root operations, documenting them properly, and keeping up with new technology codes are all fundamental to accurate coding and effective communication within the healthcare system. This concludes our overview of the coding essentials, tying everything together in the bigger picture of healthcare documentation and reimbursement.